Welcome to this video on medication for use in mental health disorders. My name is Katherine Kennet. I am an ST5 psychiatry higher trainee working in CAMS, and I'm going to tell you a little bit about medication that we use in mental health. I'm going to give you an overview that hopefully will be a nice framework for you to hang your revision onto, and if you've got any questions, hopefully you can find the answers easily, and I hope this makes things clearer. So I'm going to start by talking about antipsychotics. I've made some highly sophisticated visual aids with some paper and a pen, which I'm going to talk you through. Now, antipsychotics are medications used in psychosis. Now, psychosis, not to go into this in too much detail now, but psychosis is a symptom, and you can have multiple disorders which have psychosis, such as, but not limited to, drug-induced psychosis, part of bipolar, schizophrenia, schizoaffective, psychotic depression, and various other ones as well. So antipsychotics can be used for all psychotic states. We sometimes use them in other settings as well. So antipsychotics come in two different classes, or groups, sorry. We call them typicals, or first generation antipsychotics, and they're the ones made in like the 60s and 70s, and then we have the much newer ones, what we call the second generation, or the atypicals. So I've drawn them here. We have your antipsychotics, you've got your first generation and your second generation. Now, when you're learning about antipsychotics, it's important to know which class they fall into, because although they're all a little bit different, they tend to have the same overall characteristics in terms of side effects. So first generation, that's our older antipsychotic medications, also known as typicals. They give you the classic set of side effects known as EPSEs. That's your extrapyramidal side effects. Now there's about 4 or 5 of them. It's really important to learn about them. Look them up, they're nice and easy to learn. They are things like restlessness, funny muscle movements. They're very unpleasant and they're important to consider, and that is part of the reason why the industry made the second generation antipsychotics, to try and combat